Every 20 seconds, someone is hospitalized because they can't breathe. Asthma affects more than 260 million people worldwide. But this is more than a number. It's personal. Asthma is a chronic, sometimes deadly, respiratory disease. Yet, it's preventable and treatable.
I was a teenager when I first experienced asthma. I remember playing sports, and it was during the summer, so it was like summer league type stuff, and there was a lot of pollen in the air, and I could not breathe. My throat started closing in. It felt like it was closing in. I had trouble breathing. They rushed me to the hospital, and that's when I got diagnosed with asthma. Some of the most common triggers that happen to me or that affect me, being around cigarette smoke or fire smoke, campfire smoke, any type of smoke, it starts to trigger kind of an asthma attack. And of course, during the pollen season, I definitely experience asthma attacks more often than any other time. But if I had to say those were the two biggest triggers, it would be smoke and pollen. So for me to manage it daily, if I do experience an attack coming on, I do have inhalers at the house. I have one that I always keep on me, and then I have another kind of emergency inhaler in a drawer. If it does get too bad, then I will have someone drive me to the emergency room to take care of it. I've never had to go to the emergency room before. Fortunately, I've been able to control it with just some of the local remedies, so basically the inhalers and stuff, and just avoiding what I can that will trigger it. But I do have a backup plan if I do have to go. So there's always a plan in place. If I need to go to the emergency room, I have a way to get there. But fortunately, I have not had to do that yet. I've never had to go. Well, obviously, it affects it. There are certain things that make it more difficult. I like camping. I like being outdoors. So of course, that's going to have an impact on what I can do. The asthma's going to have an impact. So it is what it is. I try and limit some of those activities, but at least I do have something like an inhaler to use if I do experience something while I'm performing those activities.
When I have an asthma attack, when I do more deep breaths, I feel more wheezing, and what makes it worse is more jumping and running around and coughing. After exercising, I can get some occasional wheezing, but my inhaler solves the trick. I don't think this affects my performance, but maybe I have some trouble with stamina I haven't noticed yet. This is the inhaler I use that solves the trick, and this is the spacer that I use with it. Never keep your head down just because of your condition. This should be used as a way to train and fight more stronger than others. Never give up.
Hello, my name is Lee. I'm a nurse practitioner working in an outpatient clinic, and I'm here to answer some questions regarding asthma. So the first question is, what is one of the biggest misconceptions asthma patients tend to have about their condition? I think one of the biggest misconceptions is that asthma only flares up during times of illnesses or exercise, when in fact it is actually a chronic condition that requires consistent management daily to help control the symptoms, even when symptoms aren't present. And then for question number 2, for patients who are just getting diagnosed, how do you explain the differences in asthma? How asthma is diagnosed in children versus adults? So in children, especially those younger than 5 years old, you're gonna treat them or diagnose them based on their symptoms. Because of their age, they can't really be diagnosed with diagnostic tests like spirometry or PFT. So we kind of like just treat them along with their by how they're presenting and their symptoms. For adults, we can do a lung function test to kind of see how they respond to albuterol medication, and that's how we evaluate how bad their evaluate the severity of the asthma, and that will help a lot with treatment as well too. So for question number 3, in your experience, what do asthma patients need to know about how and when to properly use their inhalers? So a patient needs to understand the difference between rescue and controlled inhalers. So rescue inhalers are meant to be used for immediate symptoms relief. So those tend to be like the albuterol inhalers. You can use 1 to 2 puffs every 4 to 6 hours as needed when you're having like a wheezing or you're symptomatic. Controller inhalers are daily maintenance inhalers, and those are meant to be used every day as directed. Usually you get your steroid inhalers, and then you need to rinse your mouth after that. So the controlled inhaler needs to be used daily to help prevent asthma flare-up, and then rescue inhalers is only as needed. But a lot of patients, they don't understand that, so they mainly stick with their albuterol inhalers. So I think that's one thing that patients need to understand. Question number 4, what advice do you give to asthma patients who want to stay physically active without triggering their symptoms? One advice I can give them is to do the proper warm-up. Give your lungs a little warm-up, a little walk before you do any like strenuous activity, and using a rescue inhaler about like 15 minutes before the exercise can also help as well too. And then just know your triggers as well. If you know that in a heavy pollen season, like during allergy season, just take your allergy medication. If it's hot or if it's cold, usually asthma symptoms tend to flare up when it's colder. So when it's colder, bring albuterol inhalers with you, and then don't push it. If you're having symptoms, just kind of rest and take it slow. So for question number 5, for parents of children with asthma, what are the most important things they should keep in mind when managing their children's condition at home and at school? So parents should ensure that their child has an updated asthma action plan, and make sure that the school or any caretaker who partakes in taking care of the children know about the action plan as well, to make sure that the children has inhalers that are within reach to use at home and both at school and with them at all times as well too. And yeah, so making sure that everyone knows the action plan will be helpful in managing the children's symptoms in asthma. What do you wish every asthma patient understand about living with this condition day to day? So I wish every patient understood that daily asthma control is key to managing asthma. It is a chronic condition, like I said before. So with your inhalers, you need to be using both steroid inhaler daily to kind of maintain or control the symptoms, even if you're feeling okay. Continue to use the daily inhalers as directed by your provider, your doctor. And then this can help you feel a lot better, and it can also help prevent more severe asthma attack as well too.
Asthma doesn't affect everyone equally. Across the US, Black, Hispanic, Indigenous, and low-income communities are more likely to suffer and less likely to get the care they need. This isn't just biology. It's about where people live, work, and what healthcare they can access. Minority patients are often underdiagnosed or misdiagnosed. Without regular doctors or insurance, symptoms go unnoticed until it's an emergency. Language barriers make things worse. Many patients never get a full explanation of their condition. Even after diagnosis, access to treatment isn't equal. Many families can't afford daily controller inhalers or must rely on outdated medications. Instead of prevention, they're stuck reacting to crises in the ER. Meanwhile, patients in wealthier areas often receive full asthma action plans and proper inhaler training. Asthma risk isn't just genetic. Poor housing means more exposure to mold, cockroaches, and secondhand smoke. Low-income neighborhoods are closer to highways and factories, with worse air quality. Jobs in cleaning, farming, and factories expose workers to dust, fumes, and chemicals. Climate change adds fuel to the fire. More pollen, wildfires, and extreme heat trigger attacks. specialists. Community clinics help, but demand often outpaces resources. Strong clean air laws, like the Clean Air Act, have improved asthma outcomes in some areas. But not all communities benefit equally. Those hit hardest by pollution often see the least relief. Asthma is treatable. But to fix the disparities, we need more than medicine. We need better access, cleaner air, and education that reaches every community. Because everyone deserves the chance to breathe freely.